Hi, my name is Dr. Nasheen Hamid. I'm part of the Proactive Care team at UCLPartners and work in the commercial innovation team as well as the GP. Today we are interviewing Dr. Sarit Ghosh, who presented at our primary care network event. And Dr. Ghosh is going to go through a bit about his recent innovation and what he implemented in Enfield. Can I just start by asking you to just explain what your role is and where you work in Enfield?
Thanks, Rashid. Thanks for inviting me. So I'm Dr. Sarit Ghosh. I'm a GP and a clinical director for Enfield Unity Primary Care Network, which is one of the largest networks in the country, representing about 160,000 patients. So I've been in that role since July 19 at the advent of primary care networks. And I have two other fellow clinical directors, Dr. Sarkar and Dr. Shah, and we work as a team to try and improve outcomes for patients.
Brilliant. And what was the innovation that you implemented during this time of COVID, and what problem were you trying to address?
So I wouldn't say it was particularly related to COVID, actually. I think what we understand in primary care, we increasingly understand that prevention has a lot more weighting now in terms of health outcomes. So if we can prevent a stroke by detecting atrial fibrillation early, or a heart attack by picking up people's blood pressure, raised blood pressure early, then we have a real good chance of, reducing the burden on hospitals and really make patients' lives a lot better. So we've realised that quite a while ago, but I suppose primary care networks have allowed us to sort of crystallise that further in terms of population health management. And so we understand where the gaps are. In Enfield, there's a huge gap in life expectancy between the west and the east of the borough. A lot of that is related to long-term conditions care and prevention. So I think what we wanted to do with the proactive care framework is just have that as one element where we target patients who have conditions already, but who are perhaps at low risk of complications, and target patients who are higher risk of complications, and ensure that the right clinician sees the right patients, and therefore hopefully preventing the lower risk patients becoming higher risks in a more systematic way. And that will just be one element while we look at detecting people with diabetes and hypertension earlier as well. So actually increasing the number of people in the lower risk category.
Yeah, that makes perfect sense. And can you briefly explain what are the frameworks and which ones did you implement in Enfield?
So we were working with UCL partners from the middle of last year, actually just during the height of the pandemic. And I suppose that sort of expedited our progress on this, because what we decided was that diabetes and hypertension were two of the biggest risk factors around poorer outcomes for coronavirus. So we thought those would be two good areas to focus on, and very timely in the current context. So those are the proactive care frameworks we focused on. So we worked with UCLP to develop searches on our patient record system, which is EMIS, to identify patients who are at higher risk of complications, and as I said, and risk stratify them into 5 groups for diabetes, and I think a total of about 7 groups for hypertension. And once we'd designed the searches, we ran them, and we could see the number of patients in each group. So therefore, we were able to concurrently have a competency map for our workforce to map the different risk categories with the appropriate staff members. So we're lucky to have specialist nurses in diabetes and specialist GPs as well, and they led on our training of our clinical pharmacist workforce, who dealt with really the moderate to higher risk. The very complex patients sat with the diabetes specialist nurses that we are lucky to have. and then the more low risk patients, we've been training health and wellbeing coaches, and even healthcare assistants to an extent, to manage some of those more more stable patients. So we're still on that journey. It's nowhere near complete. Training and competency takes a long time to develop, and that's still happening as we speak. So, and unfortunately, the coronavirus has sort of halted our progress in many ways, but we're still trying to progress the best we can, really.
Brilliant, brilliant. And I mean, how do you feel that implementing the frameworks may have benefited or changed the way patients are treated, or how have clinicians received the new way of working?
So I think like any program needs, any sort of change management needs a lot of engagement, communication with stakeholders, and the way we sort of just agreed as a PCN board to tackle this, and we all agreed that it was a really important priority for the PCN, was to have champions at each of the practice sites, and nominated admin and clinical champions. And I guess they were key to the implementation of the program, and that sort of needs a lot of engagement, training, and I think it's working. It's working well, but I think we will know more in the coming 12 months as we enter the recovery phase on how well it actually does, really. But in terms of patient benefits, I guess it's about, because we can be more efficient in who sees which category of patients, patients will be seen quicker and sooner and have more of a care plan based approach, because we are training additional staff such as clinical pharmacists and health and wellbeing coaches that we didn't have before, to really manage and look after patients with shared care arrangement. So I think it should lead to more responsive, and that provides continuity. It's very difficult for patients to see a GP and the same GP at the moment, but this sort of proactive care framework gives a bit more continuity with certain groups of staff managing certain groups of patients.
Absolutely. And what kind of support did you receive from UCLP to implement the frameworks?
So UCLP provided a lot of sort of IT information, program management. I think that's probably the key. They provided us a sort of a framework and structure where we met with their team regularly, utilize their expertise in developing training frameworks, developing the IT and the searches, working with us currently to develop some performance dashboards. So all of that sort of helped us, the leadership team at the Primary Care Network, the executive arm, to really treat this as a very important priority and project for the PCN, because it was a very formal, structured approach, which I think UCLP are very good at. So yeah, I look forward to working with them on other projects, because it's been a really good relationship building exercise. I think other PCNs in the region or around the country would really benefit from that sort of approach.
Excellent, excellent. And what advice would you give, having said that, to other CCGs or PCNs thinking about implementing the framework? What kind of advice would you offer them?
So I think it takes planning, and the framework might not be for every PCN, because there's many different ways of doing things, and there's many PCNs who are providing really amazing care for their long-term conditions patients. But what we found is that if there's room to improve, which there generally is, having a planned, structured approach, such as a risk stratification methodology, along with a competency framework to train your staff, will lead to some benefits. And we're starting to see, even during coronavirus, we in Enfield, we did rather well in diabetes management and care, because we still managed to, 41% of our patients still managed to hit the target for the 3 treatment targets of cholesterol, blood pressure, and diabetes control. And in the current context, that was really amazing, because the previous year we were about 45%. So managing to get 41% in the current context, where patients didn't really want to have their blood tested, didn't want to leave home, I thought was a really, really positive achievement. So I think all of these things contribute to that performance.
Brilliant, brilliant. Thank you so much for your time today. Hopefully this interview will give other people a lot more insight into what UCLP can do and how the frameworks have benefited yourself. Thank you so much for speaking to us today.
Thank you for having me.